Okay.
Power 93.7 WBLK. I'm Yasmin Young. This is the 2 to 6 takeover. We are looking at a holiday weekend. So far, we are having beautiful weather. Just in 3 of Western New York's beaches are going to be open. You can get more details about that at WBLK.com. So this is the time when we all want to be out and about, but we are still dealing with this coronavirus pandemic. And it's always a pleasure because she's always got the most up-to-date information. Dr. Gale Burstein, the Commissioner of the Erie Department County of Health, is joining me today. Welcome.
Hello.
So as we get into this weekend, where do we stand in Erie County statistically?
Well, so far as of last night, we had 5,231 COVID-19 cases. And unfortunately, we've had 459 deaths. And we just want to reach out to the friends and family of people who've lost loved ones and just give our condolences. But we're, continuing to see more and more cases. I think the good news is that the proportion of positive tests that we're seeing now is the lowest that it's ever been. It's under 10%. It's about 8.5%. And the number of tests, the total number of tests that are done, are the highest number that we've ever had. Like last week, we had about 9,000 tests that were run. So the good news is more people are getting tested, and we're having lower numbers in the community than we have in the recent past. However, that's not because COVID-19 is going away. COVID-19 is still here. These numbers are down because we've been successful in our social distancing or physical distancing, wearing masks, which is very, very important when you go out in the public, and then also washing your hands as much as you can. Every time you touch something, even if you're going hiking in the woods and you touch a rock or a tree, you don't know who the last person was that touched that rock or that tree. So you really have to bring a good hand sanitizer with you or go to a bathroom with running water and soap. So those are things that we still have to continue doing, even though the weather's nice and even though businesses are opening up.
And we've been, under lockdown for 2 months, maybe a little bit longer. I've kind of lost track of time. But as we move into Memorial Weekend, we're seeing more businesses opening. Of course, people, have had cabin fever. They want to get out and about. What are the best practices to be able to, have time with family and friends this weekend, but still be mindful that COVID-19 is still here?
Right. You're right. COVID-19 is still here. So we still have to continue with the physical distancing, wearing masks, and washing our hands. So for the Memorial Day weekend, it would be, the Erie County parks are open. So if you want to go to a park, that's a good idea. Try to go to the parks that are usually less crowded. So Chestnut Ridge Park is a beautiful park, and a lot of people go there because it is so beautiful. However, we're trying to avoid crowds right now, so that might not be the park that you want to go to this weekend because you know that there'll be a lot of crowds. And wherever you go, just make sure that you stick it to your family, so the people that you're in your home that you're in contact with all the time. So this is not the time to go on a hike or to the beach with friends. We still have to social distance with friends. And then, wherever you go, bring along a mask. So if you encounter other people, make sure you put it on. Masks are very protective. We know that with our experience now wearing masks and seeing the numbers decrease in our community, we know that they offer much more protection than we had originally imagined at the beginning of this pandemic. So masks are also very, very important. So those are things that we still need to keep doing. We still need to keep doing the things that we've been doing so far to bring our numbers down because we want them to stay down. If we see an uptick in numbers, then we'll be so many more people that are ill. We could be at risk of going beyond our hospital capacity with so many people getting ill. We'll start to see a lot of deaths again, and we'll start to see businesses and everything shut down again. And we don't want to go backwards. We have to keep going forwards, and that means that we have to continue with the social distancing and wearing masks and washing our hands. That's not changing because COVID-19 is still here.
Absolutely. And as we approach summer and parents are getting back to work and they may not have the same options that they had last summer with summer school, maybe a relative is now watching their children, or maybe it's a neighbor. What are some of the things that they need to keep an eye on as far as immunizations, health checkups, and then the best practices for their kids going into the summer?
Right. So unfortunately, we have not received guidance from the New York State about whether summer camps will able to be open or not. And if they become open, if they are able to open up, we know it's going to be a different scene than the summer camps in the past, because the kids will have to be in smaller groups. They'll have to be more social distancing with activities. So there'll be a different type of activities, more hand washing. People will probably have to maybe have to bring their own meals, or there'll be individual meals served. No more buffets. So it's going to be a really different scene if camps are even able to be open. And so we want to make sure that kids are in healthy environments. So again, if you're going to put your kids in childcare because we're able to go back to work, and we're really excited that we're able to do that. We want to try to make sure that the child care has good access to hand washing. Hopefully it'll be a consistent group of kids all the time, so you won't have big exposures to new people all the time, and make sure it's small groups. I mean, if somebody in the group gets sick, then hopefully it won't be this huge outbreaks because there are 30 kids in a classroom rather than say 5 kids are affected in one room. So that's what we're trying to do is keep it small. And then we want to stay healthy throughout COVID-19. And there's the more bugs out there and healthcare issues out there than just COVID-19. I know that's what we've been focusing on lately, but we have to think back about what type of regular care that do our kids need that we have to continue, because that doesn't stop. Our kids still need their maintenance visits. They still need to see their pediatricians for the screenings that are recommended. They still need to get those immunizations. We don't want to have, in addition to COVID-19, an outbreak of measles because no one's getting immunized. And then this fall, when flu vaccines available, we don't want to have a huge outbreak of flu in the community in addition to COVID-19. So it's really important that kids keep up with their child care visits, as it is important for adults to keep up with their maintenance health care. So we know that as an adult, there are immunizations that are recommended, so people should still need to go in and get those immunizations because that doesn't change. And then also there are still routine health maintenance screening exams that need to be done. So so some of them can be performed that are not invasive, say like a mammogram or getting a blood test, screening for anemia. And then there are some that are more invasive that we have to put on hold for now, hopefully for not too much longer, say like a screening colonoscopy, like screening for colon cancer. However, there are other types of screening for colon cancers that just involve sending in a stool, a sample of stool by mail to a laboratory, and so that would be a way that people can do colon cancer screening. So those are all things that we should think about and talk to our healthcare providers, because the need for that maintenance care doesn't change just because there's COVID-19. And now there's more information out there. There's more guidance for offices about how to provide these maintenance healthcare services safely. Many offices, they have guidance about how to segregate patients by well and ill, and they may have certain times, for example, of seeing just sick patients, and certain times, for example, just seeing well patients, and just seeing well patients in certain rooms, and not seeing sick patients in those same rooms. So there are a lot of different strategies available out there to make sure healthcare providers are able to provide these services safely and not expose themselves and not expose their patients. And so, we have it down now. We've had time to figure it out, and I think people shouldn't be afraid to access the healthcare system, because we still have the same health needs that we had before COVID-19, and we still have to make sure that we fulfill those.
If you watch the national news, you hear talks of maybe a second wave in the fall. Is that a realistic, possibility that we could have here in Western New York?
Yes, it is a realistic possibility. Again, none of us have a crystal ball, so we don't know what happens. But as more businesses opened up, there'll be more opportunities for a community transmission because there'll be more social mixing in the community, and also with the colder weather, people will be back inside, which provides more opportunity for disease transmission. And we also scientists believe that there could be a seasonality to the COVID-19 virus, just like there is for other coronaviruses. So with the colder weather coming, more businesses open up. Schools might be in session. We don't know. So again, there will be more opportunities for big social mixing and community transmission. So there very well could be a second wave, which will be complicated by the other. We always see a wave in our community in the fall of general respiratory viruses. So we're going to be dealing with those regular respiratory infections that we usually see. And in addition, COVID-19 and trying to figure out who has what will be a challenge. We're hoping that technology will forge ahead and help make it easier in healthcare to be able to determine who has what. Just like many people know that there are rapid flu tests available in the community where the doctor can just collect a nasal swab, a specimen from the inside the nose on a Q-tip, and then test that rapidly for flu. And we're hoping that the same test will be available by this fall for COVID-19. So these rapid tests, so people come in with a fever, respiratory symptoms, we'll be able to tell who has flu and who has COVID-19. So we're really hoping that technology becomes available. There is a rapid test available now. There's just one on the market that is made by a company called Quidel that makes rapid flu tests, so that they have a lot of experience in making these type of rapid tests. So we're hoping that more come up on the market, and so it will be easier for primary care offices and urgent care centers and emergency departments to get access to those for them to use in their healthcare systems that we frequently access.
And I know you all have several websites where you update information. Can you give out those web addresses?
Sure. So I think the big website that has all the COVID-19 information is www.erie.gov/COVID-19. So you can do a Google search on that. Also, there's some great information on the New York State Health Department's website, especially for businesses that want to try to figure out, am I open? When can I be open? What do I have to do to prepare? There is great information on the New York State's website, New York State Forward, and that is, that has specific sites for businesses to give them information they need to prepare to reopen. So, and then we also have really great information on the CDC's website. You can just go to www.cdc.gov and put in their search engine COVID-19, although that's on their homepage, so you'll be able to see it pretty quickly and get that information. Also, we have a new website and the Erie County government that gives people information about testing locations for COVID-19. And so if people want to get a test, they think they might be at risk for having an active infection, so they would want a molecular diagnostic test, which is a nose swab. Or people might want to know, hey, I think I was infected in the past, like a month or so ago. I had this illness. I never got a test for it. I want to see if I have antibodies to COVID-19. And so that we would also have information about antibody tests, which is a blood draw on there, so those locations. So this website has a map, and then when you click, you go to the map, and then you see a site like a little star that looks like it could be close to you. You can click on that, and it gives you more information about the site. And so the email address for that is the website for that is www.erie.gov/COVID test sites, all one word. So that's all some great information we have for our community, and I really hope people go online and get information, and really, information is power, and information from credible sources is really the best power that you can have. We know that there's a lot of junk out there. There's a lot of rumor out there on Facebook and blogs and Instagram, and you want to make sure that you go and get your information from a credible source, because information is empowering. And if you have false facts, it might cause you to make bad decisions that can cause some harm for you and your family.
Absolutely. And I've got those links on our website, WBLK.com. Dr. Burstein, thank you so much. And, again, thank your team at the Erie County Department of Health for all that they've been doing to make sure that we can fight this and come out on the other side.
Thank you.